School is back in session for many, meaning students are lugging around heavy backpacks, but that could be a problem for their health. Here with us today is Dr. Richard Busch from Busch Chiropractic. Thanks for joining us today.
Thank you for having me.
So first, why is a heavy backpack such an issue for kids?
Well, if you think about it from the standpoint of, first of all, the size in relation to, the size of the little kid.
Yeah.
In a lot of cases, they're overfilling their backpacks. It causes postural alterations. People have to lean forward, causes neck problems, lower back problems, and pain in between their shoulders. It can help overdevelop the muscles on the front side of their spine or their chest because they're actually pulling things forward. And so we start to see rounded shoulders and a little bit of a hump back along with that. But then along with that, we have things that are as simple as, losing your balance because you're carrying too much weight on your back. And something that we see with women who carry purses that are way overloaded as well. Sometimes if the straps are a little bit too small, or again we're just carrying too much, it can actually put pressure on the blood vessels that go down into your arms or your hands, which will cause numbness and tingling, and it can even cause damage to some of those nerves that go down into your arms or your hands. So it's very important to make sure that we're paying attention to, first of all, what we're sticking in our kids' backpacks. And then along with that, making sure that we're actually following a couple of different rules along with that.
Right, so first we're going to talk about how to properly fit a backpack, but first, how heavy should it be?
No more than 10 to 15 pounds, or no more than 10 to 15%.
Percent of the
Pounds
person.
are different than percent.
Right, yes.
of the child's body weight. So if you think about it, if they weigh 40 pounds, then you probably shouldn't have any more than 6 pounds in their backpack.
Okay.
Okay, so obviously that translates, and once you hit somebody who's over 100 pounds, you don't necessarily want to have them carrying 15 to 20 or 10 to 15 pounds all the time in their back.
Okay, so I put a backpack on. This is too low though, right? So where should it be sitting?
What we want to do is we want to actually pull this up a little bit and make sure that it's about no more than 2 inches below the patient's or the person's weight.
Okay.
Waist, I'm sorry.
And use both straps. So many times you see one and then they're kind of sideways, offsetting the weight.
When we were kids, it was always cooler to just use one strap. But at the same time, that also puts a lot of different stress on the person's body. And again, can cause pressure on those, on what are called the brachial plexus, or the nerves that go down to your arms or your hands, the blood vessels in your arms or your hands, and we can see numbness, tingling, weakness, or even nerve damage over time. We see that with women's purses all the time as well, where they're wearing carrying something with a small strap just on one side, and they're carrying a way too much weight in that purse. I know everybody does it.
Guilty of that.
We talk about it all the time, but at the same time, there's some little things that we can do to prevent problems from ever occurring.
Dr. Busch, thank you so much for coming in today. Great information.
Always.
You can learn more about Busch Chiropractic by calling the number on your screen. I'll put both straps back on, or visit buschchiropractic.com. I'll send it back to you, Pat.